article that we looked at reading, or were allocated to, was looking at the effectiveness of occupational therapy interventions for adults with rheumatoid arthritis, which was a systematic review. It was completed by Patricia Siegel, Melissa Tanzaka, Beverly Akadaka, and Jeanette Pohl. And the objective of this article was to review the efficacy of occupational therapy related interventions for adults with rheumatoid arthritis.
The methodology of this article involved examining 51 level 1 studies. 19 of these studies results were related to physical activity and 32 were related to psychoeducational. Each article was published between 2000 and 2014 and were identified from 5 databases.
So the systematic review found strong evidence to support the use of physical activity and psychoeducational interventions to improve function, pain, fatigue, depression, self-efficacy and disease symptoms in people with rheumatoid arthritis. None of the included studies reported adverse events or increased disease activity in the participants. And therefore physical activity appears safe for people with RA and does seem to improve pain and function. So although the majority of RCTs reported group differences in favour of the intervention condition, a small number of studies found no significant changes in the intervention groups compared with control groups. And these studies often involved interventions that were short in duration, such as 1 week. Studies on Tai Chi found that even though the physical measurement of symptoms did not change, self-report scores indicated improvement. Several of the studies included in the review, especially those using joint protection, CBT, or a multidisciplinary approach, found long-term improvements in function, pain, depression, and self-efficacy from 6 months to intervention. So additional high-quality research is needed to demonstrate the efficacy of assistive technology in people with RA.
Go.
So they concluded that the following implications for occupational therapy were occupational therapy practitioners should be mindful of each person's disease process and plan around both flare-ups and stable periods to make the most of interventions. They also found strong evidence was found to support aerobic exercises, resistive exercise and aquatic exercise as individual interventions for the reduction of pain, improvement of quality of life and overall independence. Occupational therapy practitioners may incorporate exercise approaches such as coaching, home exercise, aquatic exercise, general strength training or aerobic exercise. Occupational therapy practitioners may use components of Tai Chi, yoga, or dynamic exercise programs to improve fatigue, depression, and vitality, or recommend that clients participate in community-based programs. Practitioners can use a variety of psychoeducational interventions such as general patient education, self-management, CBT, and individualised joint protection to improve function, pain, fatigue, depression and self-efficacy. And lastly, practitioners should keep in mind the outcome of self-efficacy to empower clients with RA. Even though laboratory measures of disease activity may not appear to change, improvements in self-efficacy may have positive effects on psychological status, function and overall well-being.